Hello, everybody. My name is Dr. Joshi, founder of Prestige 2.0, and here with Matt at Purdue Federal, one of the largest, if not the largest, depending on how you measure it, credit unions in the state of Indiana. And with that, I'd like to welcome Matt.
Hi, glad to be here again. Thank you for having me. Again, my role at Purdue Fed, I am the VP of Business Development. I do go around and I talk with businesses about signing them up as select employee groups. So if anyone's ever interested, I can definitely help along those lines. As far as my background in financial services and consumer banking, I've been in banking for about 13 years or so. Started as a licensed personal banker at Chase, moved to management at Fifth Third, and then before that I was even licensed to sell healthcare. Those licenses are lapsed now, but it does help when talking about the HSAs and things of that nature. And then I've been doing this role for about 6 years or so. So yeah.
Awesome, Matt. I mean, clearly you have a breadth of experience. Let's maybe go step by step for the listening audience to kind of understand what value Purdue Fed HSAs can provide. So maybe we can start with the basics. What is a credit union? What is Purdue Federal Credit Union? And then what is an HSA? If you can go 1, 2, 3.
Sure. So Purdue Federal Credit Union, we are what's called a select employee group-based credit union. That's how credit unions, because of their tax advantage status, because they are non-for-profits, not anyone can just walk in the street like you can at, say, a retail bank. You would have to qualify for membership. Now, there's, again, two types of credit unions out there. There's the geographical area. Basically, you live, work, worship in a particular area. You can come in and open an account. We are the latter. That's the select employee group-based credit union. Our largest select employee group is actually Purdue alumni, Purdue faculty, Purdue students. But there's a lot of different ways to get people qualified that they might not know about. So I always encourage people to come in, and we'll find a way to get you qualified for sure.
Awesome.
Yeah, I'm sorry. There was another part with the health savings account.
Yeah, so just really kind of let the audience know this is what a credit union is. This is Purdue Federal Credit Union, and what's an HSA that you can get within Purdue Federal.
Yeah, I mean, I know we're going to be talking about this quite frequently throughout the podcast today, but an HSA is basically a tax advantage savings account that you can use to pay for qualified medical expenses, and it's paired with a high deductible plan. It's going to allow you to set aside money, usually through some pre-tax contributions, and can be used to pay for things like deductibles, co-pays, co-insurance, and you're not paying on the withdrawal. So it's really taking on that tax advantage status. And I know we'll get into some of the additional benefits later on, but that's kind of a brief overview on health savings account, and we do offer them at Purdue Federal, and we'll kind of go through some more of the benefits on those as well.
Perfect. So before we delve into the benefits, let's just talk a little bit about why we're even having this conversation. Why are HSAs so important? Because there's clearly major macro trends that you see in the financing world that the average patient, average consumer may not see. Talk a little bit about these high deductible plans, how they're becoming more and more pervasive, and what that means for the patient.
Yeah, well, funny enough, I was actually licensed to sell healthcare back when the HSA was, or not the HSA, but the ACA was getting rolled out. So a lot of these different types of plans that had kind of popped up at the time, they are continuing, and that's coming all the way back from 2009. The big overall macro trend, obviously, is that healthcare costs are continually rising. They're continually going up. It is one of the biggest expenses for employers. It's one of the biggest expenses for municipalities around state, local, federal governments, things like that, because you have to provide that healthcare to the worker. We can go on a completely different tangent that could take up to 3 hours on whether or not it has people's best interest in mind. But
spoiler alert, to be continued, right?
Yeah, exactly. To be continued. But at the end of the day, it is just where we are going. So a lot of you're moving away from those PPO type plans in an effort to save the employer's money and actually be able to still offer some type of benefit to their employees, but not bankrupt them in the process. So Yeah, it's just kind of the reality of where healthcare is going.
Yeah, talk a little bit about the numbers themselves. So, 1,600 for an individual, 3,200 for family. What does that mean in terms of the deductible, and where does an HSA come in to help fit that gap?
Well, the HSA is going to be able to help fit that gap between the high deductible plans. So when you do come to that high deductible amount, and you are paying those copays, you have that money set aside to actively take care of that. I work with a lot of families when it comes to budgeting. I give presentations on budgeting all the time. We know in America, it's just the reality. A lot of people live paycheck to paycheck. 49% of families can't afford a $400 emergency out of pocket. 54% of families can't afford a $500 emergency out of pocket. And the more that number goes up, obviously, the more the trend goes negatively. So what that leads to is, people putting emergencies on credit cards, and that's not what they're used for. 73% of all bankruptcies in America contain some sort of medical debt. So you need to make sure that you are planning for this and you're making it a part of your budget plan and your savings, so that it doesn't creep up and bite you when something, regrettably does happen.
Yeah, it's tough that we live in a time where things are relatively uncertain, and again, that is another 3, 4, 5, 6 hour conversation.
Absolutely.
But for the individual who's looking at this and saying, okay, 1,600, okay, maybe I can swing that. 3,200 for my family, maybe I can swing that. Why actually open an HSA? What are the benefits of that account in particular?
Well, again, we kind of talked about earlier some of the different tax advantages. That
Yeah.
really is the biggest the biggest benefit. Using it for those qualified medical expenses, can be a wide range of qualified expenses. Doctor visits, prescriptions, dental care, vision care, things like that. There are different, just like other investment type vehicles, such as your 401ks and things of that nature. There are annual contribution limits for individuals and families. It's going to help you. Now, again, we always encourage, and I'm going to say this throughout when we're talking about it, we always encourage people to sit down and talk with their tax expert. If you come into the branch and you're looking for strict tax advice, we're going to direct you in the direction of a CPA. But we can't talk about general trends. And lowering your taxable income is something that it can definitely assist you on if that's something that you need.
So how does this work then? Just talk very fundamentally. How do you put money into the HSA, and then how do you draw out of the HSA?
So that is one of the advantages about having it at Purdue Federal Credit Union. We can do those transfers directly from, your checking account, directly from your savings account. You can set those up like any other type of savings transaction where you are looking to have that money move consistently on its own. Because, like any other savings plan, if it's out of sight, it's out of mind. And most people, when they develop a savings plan or when they're budgeting, they typically do it a couple different ways. They go bills, then they go fun, and then they say to themselves, well, if anything's left over, I'll make sure that it gets into savings. Well, we all know it doesn't happen that way. It kind of finds its way out of your account. You see a pair of shoes that you maybe not really need. So setting up those reoccurring transactions and saving for that money to be moved over, we can take care of that in the branch pretty easily for you. Plus, from our mobile app, you'll be able to see your balances, things like that, and you can come into the branch and make those withdrawals. We give you an HSA debit card on top of it, so we make it easy for you to access those funds. And
Now, do they need an account with Purdue Federal, or could they have an account somewhere else and then open an HSA at Purdue Federal?
You could, you could definitely, we can definitely show you how to link those accounts to another financial institution and then utilize the HSA there. But like anything else, the more you have at a particular financial institution, it just kind of eases everything across the board.
Yeah.
You know what I mean? So,
talk a little bit about maybe overarching strategies that people can use with the HSAs, and then the actual tools Purdue Federal has to implement those strategies.
Well, again, we touched on it earlier with the savings accounts. Just making sure that you are making it a part of your everyday savings. The federal government recommends that you set aside about 3 to 5% for healthcare costs of your annual salary throughout the year. This is part of that. In
Hmm.
addition to paying your monthly premiums through your employers, a lot of employers are actually trying to help ease the load when it comes to HSAs, and they are actually contributing directly to the HSA because that is helping offset some of the costs of healthcare for individuals. Does that make sense?
Explain that maybe like through an example, just because I want to break it down so simply because, you know, I don't think as many, in just full disclosure, in
Yeah.
the patients that I talk to, I don't think that many patients are aware of HSA, and of those who are, they kind of see it as something as like, oh yeah, it's a good idea to have, but they don't actually know how to go about it.
Yeah, no, it's really even beyond just a good idea to have. It's definitely becoming a necessity. It's like having your emergency savings account and things of that nature. And I think that's the reason why, going back to the overall budgeting, that's why people tend to just kind of push it off because they say, I can't sit down and I can't really save enough to make it worthwhile. So why should I even start? And we just try to get in people's heads. You have to get in that habit. Like once you get in that habit of putting that money aside and having it for the rainy day, that's really where the value is. And the tax advantage status just makes it a no-brainer at the end of the year. Like when you can lower your taxable income and you're not penalized for taking out any of those funds and things of that nature. Like it's a great vehicle.
Sure thing. And so, contextualizing it, let's say back to Prestige 2.0. Oftentimes, the weight loss injections, the muscle enhancement peptides, the hormone replacements, they're just not covered by insurance. So, how can a patient come about verify that those services could be covered by the HSA and then proceed from there?
That is something. Now I do know for that's going to be a conversation for your office and for the patient and then their healthcare provider, because obviously you deal with a lot of healthcare providers. They'll say, oh, we cover this amount percentage or we don't cover this percentage, but to my knowledge, we should not have any issues, utilizing those funds in an HSA to pay for those services because those are qualified medical services. So,
Yeah.
if especially people are looking to just, have that just a simple tax advantage in while still utilizing your services, even if it's not covered on their particular plan, that's just another layer of advantage for them.
Yeah. And many people might think, oh well, $50 a week or $100 a week. What is the real tax savings that can come from that? Talk a little bit about the calculators that you guys have online and kind of just the savings that people can glean over years of using an HSA because it really does add up.
Oh, 100% adds up. I mean, like you just said, $50 a week, versus $100 a week. $100 a week is, $5,200 for the year.
Yeah.
I personally could do a lot with $5,200 a year. Like that's a vacation. I don't know about you, Jay, but my wife would be pretty happy
Yeah.
taking that $5,200 a year. Now,
I
again,
would be very happy.
exactly, I would be very happy. And you're not getting that. I don't want to make it seem like anyone is giving you that $5,200 back because sometimes there's misconceptions when it comes to taxes and things like that. But if let's say your taxable income is in at 150,000, like just as an example. Like these are not the actual tax brackets. I am not a tax expert, but this is just a gross overview of the plan, and you are like the bracket cuts off at 154. Okay, and you've done the max contribution to your HSA of, in this scenario, let's say $5,000. That's going to drop you to 149, and that is going to put you in the previous tax bracket, and that way you're not paying additional taxes on that money that would have taken you, because obviously we have a graduate system. You're not paying it all the way back on all of your funds and things of that nature, but for that chunk that would have taken you over, it's lowering you and giving you that tax advantage status at the end of the year. Now again, you want to make sure that you are checking in with your your CPA, with your financial advisor, to make sure that this is accurate for yours. But that's just a general example on how it can lower your taxable income. And sometimes lowering your taxable income is just as great as getting the money back in hand, because that's kind of how it operates in some respect. Yeah.
And so, kind of disclaimer: this is not an official tax podcast. We are not providing official tax advice.
Yes.
Proceed with caution, what have you.
Correct, absolutely.
But you clearly do see things working in the financial realm regarding 401ks, HSAs, and things like that. What are you seeing now in just patient behavior as it relates to financial literacy?
I think people are starting to become, now at this point, they've been around for, 10 plus years, 15 plus years. I think people know that they're out there. Also, again, like we talked about, more employers are going to those high deductible plans, so people are becoming more used to them. They're going away from, Blue Cross and Blue Shield, that's what we've always had, and those types of things. So people are just, because of what their employers are going through, are going through the advantages and in some cases disadvantages of high deductible plans, and it's just something that they're having to educate themselves on. Hopefully they're able to educate themselves prior to an event, because that doing it in reverse is never good for the family. But we have people come in and they say, I know I need to do this. How do I set it up? And then we just kind of go from there.
Yeah, and that's the key thing for people to understand, that a lot of this kind of seems like voodoo when you're just coming across it, but just talking to people like Matt, going to places like Purdue Federal, really does help to simplify the process. And as a physician caring for patients, I can't tell you how many times the cost of care comes into the conversation, and it's no longer something that is hidden or something that's kind of shameful to discuss. It's a reality of healthcare, and it is a cost constraint. There's a concept in the oncology space, the cancer world, called financial toxicity, and it relates to just the number of people that end up in bankruptcy after they go through rounds of chemotherapy. And what's sad about it is that they beat the cancer, but they couldn't beat their financial troubles. And it kind of relates to just the reality that we're seeing in healthcare today, and why an HSA is so important. What can a patient do to maybe get a hold of you and address any sort of questions or concerns that they might have?
Absolutely. I always encourage any questions coming my way. I give out my cell phone number to everyone. It's 219-742-3289. Can give me a call at any time. My email is first initial, last name, MSCHEUER @PurdueFed.com. I kind of think of myself as the point guard for Purdue Fed in the area. I kind of get people where they need to go, and we have a bunch of different experts in the branch that can definitely help you, get those accounts opened. If you even have to take it a little bit further, we do offer financial counselors at no cost. It's something that I'm very proud of that Purdue Federal does. They are down in Lafayette, but we can set up these types of one-on-ones via Zoom, over the phone. Obviously, post-COVID era, technology really isn't a distance anymore.
Yeah, exactly.
So it's kind of nice. For spoiler alert, Jay and I are not in the same location filming this.
No, we're not. No.
This podcast.
Matt is not in our inventory room.
I am not in the inventory room. But it's just, we have those types of vehicles because, again, like we talked about before, it has to become part of your savings plan. You have to plan. You have to take that time and I'm not planning for the worst, hope for the best, but that's kind of what insurance is.
Yeah.
Regrettably, and you don't want, on top of what you talked about from the oncology space, it's very disheartening because not only are you taking time off work there and you're probably draining your bank accounts in that regard, but to have to deal with healthcare costs on top of it and have to deal with high deductibles that you didn't have the deductible set aside for. It's going to add to the stress later on.
Yeah,
So.
without a doubt. And to that vein, there's a lot of things offered at Purdue Federal through online venues. You can sign up for an HSA through the online portal on the website itself. Talk a little bit about what people can expect when they come to your website.
Yeah, I mean, you can definitely get on the website, open that up. You're going to have one of our member consultants would end up reaching out to you to kind of get some final documentation. We are there to walk you through any step of the process. I know it can get confusing for people sometimes, but yeah, I mean, we make it easy. You will be able to access that from the app. I have had people also, obviously technology, I always say, mileage may vary.
Yeah, exactly.
But I have people that they go, no, I was comfortable opening it right from my phone, and they have some people that are like, I'm going to bring in my laptop, and I'd like you to kind of walk us through how this is going to look. We are completely comfortable doing either, whatever works for you. We want to meet our members where they are. And sometimes that takes a little bit more walk through and comfortability level to get to where they need to go. So
Awesome. Well said, Matt. In the remaining time that we have, could you maybe give one or two nuggets of advice for those who are listening and considering getting an HSA and considering Purdue Federal? I know we touched a little bit on the employer benefits, but maybe kind of give a few key takeaways for the patients that are listening.
Yeah, I mean, following the trends of healthcare, where we talked about where they came from and where they're going, they're just going to continue to grow in terms of the popularity, and given all the benefits we've already discussed, it's going to be incumbent on contingent on any employers that are going to go to those high deductible plans. But at a certain time, they are going to be as standard as like we mentioned, a 401k being in someone's portfolio. And the biggest piece of advice is to come in and have those types of conversations, because I see this across every area of finance, is just the unwillingness of people to have the conversation. We in America, we attach a lot of social status with money. So when you're talking about where your funds do or do not go, it can be kind of uncomfortable sometimes. But I can tell you, we have seen it all at Purdue Fed. I've seen it all in banking as a whole. I've seen people who they would say make very modest salaries do very well for themselves because they're very, very good with money. And I've seen a lot of people would, not there's anything, wrong with this, but I've also seen doctors making $250,000 a year that have $80,000 in credit card debt. And it's not hard. But yeah, I mean, it really is. If I was going to give the biggest nugget to anyone, tying it back to what we've said all the way through the podcast, if you want to take control of your healthcare spending, you have to take control of your spending as a whole, and you have to start with the budget. When you start with the budget and you track your spending and you know where your dollars are going, you have the power to allocate them appropriately, because every year come open enrollment time with your employer, you're left saying, well, should we go with this high deductible plan maybe with my spouse, or should I go with the PPO with my wife that works here? And that way, if you know what your spending is, you can sit down during that open enrollment time with your loved ones and truly make the most informed decision when it comes to your health care. And whatever your decision is, having the HSA and knowing that you have that money in the bank to meet those deductible needs is a benefit for everyone out there. So.
Yeah, well said. Matt, thank you so much for your time. I look forward to continuing the conversation.
No problem. We'll talk soon.
Take care.